I, for one, will not let you slide, regardless of your personal faith or not. You can rectify that on your worship days and provide me my service.
So where is legislative action as part of addressing mental health issues or provision of services for the LGBTQ plus community?
Well, I think the misconception as well is that there needs to be something specific for LGBT people, but I think what we actually are asking for is that within the provisions that already exist, that we ensure that LGBT people are included in those things that are already existing, right? So it's not like we're asking for special anything. I think when it comes to mental health, provisions for LGBT people or mental health services for LGBT people, what they need to be is, the providers need to be trained rather in how to address issues that are affecting LGBT people, particularly trans people, because trans people, of course, in terms of just discrimination and stigma, face it to far more severe degrees, particularly Black trans women like myself. And so, I mean, in terms of, it's just making sure that when we say we're providing services for trans and LGBT people, is that those services are community specific and they're community centered, and so that they need to ensure that the people who are providing those services are trained to do so.
So if you had the health minister before you, who's a member of the cabinet and a policy person, if you had him on the program just now, wouldn't there be any specific legislative push that you'd make among the suite of solutions perhaps you propose?
Well, I mean, legislation already exists. I think that's what I'm trying to say in terms of, because healthcare, everyone is supposed to have access to healthcare. And so that's not the problem, because once you're a Jamaican citizen, you are afforded certain rights. So that's not the issue. The issue is making sure that those services are accessible to members of the community, right? And for some, that might look like having an addition to a policy that exists that says including LGBT people, because of course, specificity is important. But to me, it's also ensuring that the persons who are providing the services, the areas that people can access those services, all of that is community centered. And so taking into mind where people can actually access those services and who are providing it, making sure that our psychologists and our clinical therapists, all of that, they're trained, they're sensitized, they understand the issues, and so therefore they'll be able to provide the services.
What's the government been doing to improve the provision of mental health services for members of the LGBTQ plus community?
While we do not make any significant distinction between the LGBT community and the general population, we do recognize that there are some unique circumstances depending on the cohort and particular segments of the population. So we, as you know, in 2016 had commissioned the Mental Health and Homelessness Task Force report. And we, out of that report by Dr. Earl Wright, came a number of recommendations. The institutional review and the de-emphasizing of institutionalization. So Bellevue, for example, is under significant review to look at how it is structured to separate those that are more part of an infirmary type setup from those who need care, expanding community-based efforts, going into the communities, creating greater mobility, and adding more mental health personnel in the field. I would say, as a blanket statement, that we promote the concept of non-discrimination in terms of access. And so any service that we offer to the population, it would include all segments of the population, unless there is a particular issue which I would want to hear about. I just want to reemphasize that because I know normally that is the main challenge.
If you're a private service provider, I think what the research shows is that, LGBT people, they tend to, once they realize that your mental health services are being provided along the lines of a more kind of faith-based set of principles, that they tend to shy away from it because they do have a certain perception of it. And so there's no I've not noticed a desire within the community to force faith-based practitioners in their private spaces to provide specific services to them and to acknowledge their realities. I think when we get to the public health system, it becomes a bit more trickier because I think you have less leeway as a public health service provider to provide services in a way that may be harmful or to not provide services at all. So for example, if you were of the belief that only women who were married should have children, and an unmarried woman comes before you about to give birth to a child, is it that you deny that service, and do you have the room to then use your faith as a basis to deny that service within the context of the public sector? And so I think in the private sector, I think people generally avoid it. I'm spending my money. I'm not going to force you to take my money to give me subpar service. But I think when we talk about the public sector, it's a bit more nuanced and complicated than that, because there's a higher level of responsibility among public sector workers to provide services to everyone, regardless of their own individual beliefs about the people who come in front of them.
If we're being honest as well, in terms of the community who access services, more community members actually access private services as opposed to, for those who can afford it, as opposed to the public health spaces, because that's where they find the Christian persons who may work in the space, and they will get some of those conflicting views. All right. Of course, I think what's been happening though is that more members of the community recognize their rights as citizens of this country and recognize the responsibilities of those persons who are providing the services. So they're now taking more steps to call them out if they do try to access services and don't get the proper treatment that they deserve. And so we're seeing more of that. As opposed to people just saying, oh, well, it's their faith, so we have to let them slide. I, for one, will not let you slide, regardless of your personal faith or not. You can rectify that on your worship days and provide me my service.